Hello everyone, good evening. I am Anchor Monica Tiwari Mishra from the Bladder Wellness team. Today we have with us the well-known Dr. Vishrut Bharti from Gorakhpur, Uttar Pradesh. Dr. Vishrut Bharti is MBBS, MS and MCH and is a gold medalist and practices at the Pulse Hospital in Gorakhpur. He has a rich experience in the field of urology, andrology, and is a laparoscopic surgeon. He has performed various critical surgeries and treated his patients with utmost care. Today, Dr. Vishruth will take on a very important topic, which is overactive bladder. I would also like to share that he has a rich experience in the field of urology, andrology, and is a laparoscopic surgeon. He has performed various critical surgeries and treated his patients with utmost care. He is a special interest in minimalist invasive urology, laparoscopy, and female urology. Let us hear more on OAB from Dr. Vishrut himself. Over to you, sir. We welcome you.
Hello, Namaskar. Thank you for having me on this platform. I
Thank you
feel
for
very
joining,
privileged
sir.
so as to
My
be able
first question to you
to.
is what is overactive bladder, which is OAB?
Overactive bladder actually is a clinical condition where, as the name suggests, the bladder works in an overactive manner when it should not. So, to understand it, first we should know what is the normal function of the bladder. So, the first
Mhm.
and the most important function of the bladder is to store urine. That is the storage part of the function that the bladder has, which entails storing a certain amount of urine without letting that person know that he has having urge or any abnormal sensation. So a normal bladder, a normal person can hold up to 500 600 ml of urine quite comfortably. So after this,
Okay.
once this amount of urine reaches in your bladder, so one gets a signal from his bladder that now your bladder is full and there is an urge to void, and one can desire a socially acceptable time to go to a washroom, go to a toilet, and relieve him or herself. Now, in overactive
Yes.
bladder, what happens is that this signaling mechanism is totally disrupted. A bladder which could normally store like 500 or 600 ml starts firing those signals to your brain at a very low volume, which can be 50 ml, 60 ml, 70, 80, even 100 or 150 ml, which is
Okay.
an abnormal condition and does not let the patient lead a normal life. Now, once this
Mhm.
bladder starts firing at such a high rate and such high intensity at such low volumes, patient develops a plethora of symptoms which combined are known as overactive bladder as we know it.
Okay. Thank you for the answer, sir. Can you please tell us what are the major symptoms of overactive bladder?
So, as I mentioned in describing this entity, that the bladder is overactive and the patient is able to store a very small amount of urine at a time. So, all the symptoms
Mhm.
arise from this very fact. The first and the most common symptoms that the patient might experience is frequency of urination. Now, the functional capacity of the bladder is reduced, which was 500 in a normal person. It is reduced to like 100 ml, 150 ml for such patients. So the patient has to go again and again at very short durations, which can be range from 15 minutes to 1 hour or so. Patient has to also get up at night,
Okay.
which is known as nocturia. He or she might have to get up like 4, 5, 6, 7 times a night, and in that condition, the sleep is disturbed. The another
Mhm.
symptom is urgency. Now, with sudden firing of those impulses from the bladder to your brain, that the bladder needs to void and needs to empty itself, leads to a very urgent desire to void. Suppose you are in a market or in a place where you're not able to go to a toilet, and there is sudden surge of signals from your bladder. This leads to urgency. Urgency meaning that
Mhm.
one has to go to the toilet, and if not,
Yes.
he or she might leak some amount of urine, and he or she might leak some amount of urine actually before she is able to get to the toilet. So these are the main symptoms which we know as frequency, nocturia, and urgency, and sometimes urge urinary incontinence.
Okay. Thank you, sir. And can you please tell us the causes by which overactive bladder condition can be added?
See, there are various causes. Actually, overactive bladder is of two types as we know it, the primary
Mhm.
overactive bladder and secondary overactive bladder. In primary
Mhm.
overactive bladder, there is no particular cause that one can figure out over various investigations and examining the patient, and it is more or less idiopathic or due to internal abnormalities of the urinary bladder. Now, the secondary overactive bladders can be caused by various factors, like any obstruction to the bladder outflow, like any obstruction to the urine flow, can lead to a secondary overactive bladder. Like it may be prostate enlargement in males, urethral strictures both in males and females, uterine prolapse, urethral stenosis in females. So all these kinds of conditions, any neurological conditions like paralysis or any stroke
Mhm.
that patient might have suffered in the near past, which may lead to abnormal sensation, abnormal activity of the bladder, leading to such conditions. So secondary overactive bladder has a lot of causes, and that they need to be worked upon. They need to be diagnosed and treated. While an overactive bladder of primary origin doesn't specifically has a cause, but it is more like idiopathic in nature.
Okay. In pregnancy, also we have seen that some female faces this problem or of going to washroom again and again. So, can this cause this problem of OAB?
No, actually, in pregnant females, the frequency that you mentioned is because of the reduced capacity of the bladder due to the pressure that it is feeling because of the growing uterus that is just adjacent to the bladder. It is not exactly overactive bladder as the medical literature defines it. Now, overactive
Mhm.
bladder is due to the internal overactivity of the bladder, while the frequency happening in pregnant patients, is
Mhm.
due to the compression effect of the enlarging uterus that contains the baby onto the bladder, so the bladder capacity reduces because of the external pressure, and therefore the female has to go again and again to the urine. It's not exactly overactive bladder, it's just that the
Mhm.
bladder capacity has reduced, and it automatically reverses once the delivery has happened.
Okay. One more thing, patient faces that they don't go to pass urine frequently. Uh, is this also the condition when which one can say that he or she is facing that OAB problem?
Overactive bladder entails going to the urine again and again at very frequent intervals, not going to the urine or having very long
Or
intervals between your two.
storing for the last time, storing for the last time can also cause this problem.
Pardon, please, can you repeat your question? I didn't get you.
Yes, I was asking if a person is not going to pass the urine frequently, he or she is storing it, so can
Yes.
it cause the OAB problem?
Well, it is not proven that holding urine for long hours can per se lead to overactive bladder, but
Mm-hmm.
generally, as a bladder, as it's a part of a good bladder habit regime that we prescribe patients, that one should not hold urine beyond a certain period of time. It's an unhealthy thing to do because the bladder has been made in such a way to hold a certain amount of urine and not to over expand. What happens when you hold a urine for a very long time? What happens is it expands, over expands. It is meant to contain like 600, 700 maximum. Once it goes to 800, 900, it overstretches the bladder, and then when you
Mm-hmm.
finally go to the toilet, you're not able to do it as efficiently as you can. This leads to,
Yes.
when done repeatedly over a very long period of time, then it can damage the nerve endings, nerve supply of the bladder, the muscle fibers of the bladder, and can lead to such conditions. But yes, I must say that it has not been proven beyond doubt in literature that
Mm-hmm.
just merely holding of urine for long hours, which can be part of certain professions, can individually can independently cause this condition.
When one person can think that this is the right time to go to the doctor to see that if I am facing the OAB problem or not.
Yes, that's a good question. Actually, one of the first symptoms of overactive bladder is nocturia. In older
Mm-hmm.
patients, older than 50, 60 years, we say that 1 to 2 times of urination in the night time. Urination in the
Mm-hmm.
night time, I must clarify, is going to the urine from after getting from your deep sleep. It's not like कि आप जगे हुए हैं just कि ये रात हो गई है, it's night time, that we can count it as nocturia. Nocturia is defined as going to the urine from mid sleep. That is what is
Mm-hmm.
defined as nocturia. So more than two episodes for older people, and even 1 or 2 episodes for younger individuals is a cause for concern, and one must consult their urologist. for such conditions. As far as daytime
Okay.
frequency is concerned, we say that one must be able to hold urine for around 2 to 3 hours. If you have to go to urine in a shorter duration of time, it is happening regularly over a certain period of time, then again you must consult. Other than that, any symptoms of urgency or urge urinary continence, as I described, any form of incontinence per se, you must go to your urologist to get yourself evaluated.
For sure. What are the treatments available and what are the options to cure OAB?
So there are various lines of treatment to treat the overactive bladder per se, but I must say that especially for secondary overactive bladder, the first and most important part is to cure the actual condition behind it that is causing the overactivity of the bladder. For example, that a male comes to us with an overactive bladder symptoms, but the actual cause of his condition is an enlarged prostate, which is causing obstruction, which is secondarily causing an overactive bladder. So, in such patients, merely curing the obstruction caused by the prostate will give him a high degree of relief from the overactive bladder itself. Although we also tend to add certain medications which directly act on the bladder. As far as primary overactive bladder is concerned, there are various lines of treatment. First treatment that we prescribe is some lifestyle modifications like avoiding large quantities of water, especially at night, having to take certain substances that may be irritant to your bladder, certain food items that may be specific from patient to patient, others things that like a caffeine, like tobacco, like spicy foods sometimes are said to
Mhm.
irritate the bladder. So we prescribe patients to avoid such food products. Other than this, we prescribe our patients pelvic floor muscle training, which forms a very important part of conservative part of the treatment. We ask the patients to train their pelvic floor muscles, which in turn help them inhibit these overactive contractions of the bladder and help them control such symptoms. Once the patient is beyond such treatment and is not responding and is looking for a very quick relief, then in that cases there are various lines of medical management. There are certain drugs which I think are non-medical listeners might not understand, but basically these medications inhibit the overactive contractions that are leading to all these symptoms. These drugs act upon
Okay.
those receptors in the bladder and they just tone down the activity of the bladder muscles, which are causing this premature contractions and leading to the urgency and frequency of the patient.
Okay. Thank you for the
So
answer,
these
doctor.
the last form of treatment is some invasive form of treatment where we endoscopically go and inject certain paralyzing agents into the bladder wall so
Mhm.
as to completely reduce its activity. A few of our viewers might recognize this chemical that we use. A lot of you might have heard about Botox that is used
Yes.
for cosmetic reasons. This
Cosmetic
is
surgeries.
it is used as a later line of treatment in such conditions. And again, this Botox is injected into the bladder wall, thus reducing the activity of the bladder and thus giving relief to the patient.
Okay. Okay. So one viewer is there and he's asking a question, and the question is that what is the most common cause of overactive bladder?
Well, most common cause of overactive bladder is in men is prostatic obstruction, which is a kind of secondary overactive bladder. The prostate is enlarged. There's obstruction in your urine. The bladder has to work overtime, and this leads to irritability. Like bladder is working overtime, so over a time it becomes irritable, and which leads to an overactive
Mhm.
bladder. In females, mostly in postmenopausal women's hormonal imbalances or obstruction in form of pelvic organ prolapses can lead to overactive bladder.
Mhm. Okay.
These are
Thank you,
the two
sir.
most common
Um,
the two sexes of the
mhm.
patient.
My next question to you is what test is done for overactive bladder?
See, overactive bladder in itself is a clinical diagnosis. We take history of the
Mhm.
patient. We kind of thoroughly interview the patient about their problems, their history, how long it has been going on, and the diagnosis is established there itself. Now, as far as investigations are concerned, they are done to rule out any underlying condition. As I said, secondary overactive bladder. They are done to find any underlying cause that might be causing this overactive bladder, so that we can treat those causes, and that will automatically cure the overactive part of the symptomatology.
Mm-hmm. Okay.
So
Does
investigations
overactive
and urine investigations to search for any infection, like urine culture and routine examination, and other
Mhm.
advanced tests like uroflowmetry, or a diagnostic cystourethropy, like a cystoscopic endoscopic examination of the bladder and urinary passage. All these can be done at various stages of the workup of such patients.
Okay, so does overactive bladder cause any kind of deficiency also?
Yes, overactive bladder is a very stressful condition for such patients, because it makes their social life hell. I tell you, because imagine a
Mhm.
patient who doesn't know when his bladder will start firing, and he'll have to just run to the toilet. Now, suppose he is traveling in a bus, he's traveling in a car, and he cannot get to such a facility, and he might leak his
Mhm.
urine. Imagine the
Yes.
amount of fear that person might have of just traveling and fulfilling his basic needs, like going to the market,
Mhm.
going to a cinema, going with the family for an outing. All these things become a hassle for the patient, and patient starts avoiding, kind of becomes a social outcast. So it's a very burden on the patients. The patient is suffering from very poor quality of life, and therefore it must be treated in a timely fashion.
Yes, of course. Sometimes a thing happens that people are very shy in facing the doctor or telling the people that we are facing this kind of problem. So, can they talk on any kind of groups, or how can they get connected to a doctor? What will you suggest to them?
Well, there are support groups that are online, especially thanks to the various online platforms that are available nowadays. There are various support groups that are available, but there is a process to it. You cannot go to a support group and expect clinical improvement without visiting
Yes, of
a
course.
trained and a qualified doctor. You must go to a doctor, especially a urologist, which is expert at this condition. And once he has treated you, and the psychological support can either be provided with your family or with a support group.
Mhm.
That's always there. But one must get evaluated first, because at times there are certain correctable conditions that one might miss if you are not visiting your clinician. Especially, I would want to mention this because this is especially for the old post-menopausal female patients, which in our
Mhm.
society kind of have accepted this condition, that, oh, this is how it is meant to be. This is how we are supposed to live in such an old age, like we have crossed 60, we have crossed 70, and this is how things are going to be, और अब मुझे तो इसी के साथ जीना है. So that is a very
Yes.
wrong mindset. I would, through our viewers, through your platform, I would like to give this information that no, this is not how it is supposed to be. It is a very correctable, very treatable situation, and you must take that effort to go to a hospital, go to a doctor, and get yourself treated, because you will feel that once you've taken that treatment, you're so free to go around, live your life as you want it.
Yes, because people have misconceptions that this can be treated at early age only, but you have clear our viewers that this can be treated at the age of 60 or after 60 plus also.
Yes, exactly.
There are many viewers which have been connected with us, and they want to ask you the questions. Pulkesh Mehra is there, and he is asking what foods should be avoided with OAB.
See, there are certain generic advices that we give patients, especially coffee, tea, too much of it actually, cola drinks, or very spicy foods. These are seen to affect most patients. But apart from
Mhm.
that, you have to yourself be aware about what foods you are putting into your body, and what specific kind of food product is irritating your bladder. Once you recognize it, you have to just take it out of your diet. Otherwise,
Mhm.
this is just a generic advice. A cola may, or a coffee, a cup of coffee might not affect a certain patient, but it may affect drastically for another patient. So it varies from
Yes.
patient to patient. We advise patients to be very careful, very mindful about what they eat, and if they notice that certain food product is affecting their bladder health, just avoid it.
Okay.
See,
Rajesh is there with us. You
we
want
I
to
would
add
like
something? Yes.
Yeah. I would like to add that we should also be mindful about how much urine such patients,
Mm-hmm.
water and fluids overall such patients are taking. Because we advise that such patients, if you are not having much of an outdoor activity, limit your water intake to 2.5 liters a day. That's more than enough. More than enough. The body doesn't require anything else, because if the body is not requiring it, it will just excrete it via urine, and the more the amount of urine, the more the symptoms, because again the patient has to go again and again, and especially avoid fluids before your bedtime. At least 2 hours before your bedtime you should have your dinner, and after that just
Mm-hmm.
avoid fluids of any kind.
Yes, of course. Rajesh is there with us and he's asking, is OAB just a normal part of aging?
See, aging does have a role to play, but I would not call it a normal part of aging. Yes, it is more
Mm-hmm.
common in older individuals, especially older female patients, because once the female has had a menopause, there are certain hormonal changes which also affects the genital region and urinary pathways very close by. So it does affect it, but it's not only related to age. And again, as I said earlier, one must dispel this thing that we should that old age is comes with overactive bladder and one has to accept its fate. No, yes, it is common in older age group, but it is very much treatable, and one must get yourself treated for this.
Yes, you have already described that every situation and symptoms are basis on person to person. But Arush Jha is there and he's again asking the same question. Are the all cases of OAB the same?
No, no, obviously not, because basically there are two types. As I've told before in the talk, there is a primary overactive bladder and there is secondary. Secondary overactive bladder is in so many causes, like paraplegia patients, मतलब जिनको paralysis हो जाता है या stroke पड़ जाता
जी.
है, they have a secondary, या जिसको हम लोग neurogenic overactive bladder भी कहते हैं. प्रोस्टेट के पेशेंट्स में ऐसा होता है. कोई और जैसे स्ट्रिक्चर होता है, स्ट्रिक्चर एक डिजीज होती है जिसमें यूरिन की जो नली होती है वो सिकुड़ जाती है, नैरो हो जाती है, उसमें सेकेंडरी और एक्टिव ब्लैडर होता है. तो ये सारे और एक्टिव ब्लैडर के सिम्टम्स तो एक ही हैं, मगर दे आर डिफरेंशिएटेड बेस्ड ऑन द कॉजेज दैट आर बिहाइंड देम, एंड देयरफॉर द ट्रीटमेंट रिक्वायर्ड इज आल्सो डिफरेंट इन ईच कंडीशन.
Yes, so treatments are different and everything varies patient to patient. Doctor, can OAB be prevented?
Especially, yes, it is especially true for secondary overactive bladder, because secondary overactive bladder, as I've repeatedly mentioned, is due to another condition. Now, if the underlying condition is treated in a timely fashion, the overactive bladder will not come through. Suppose a patient is having a prostatic enlargement. Right. So
Mm-hmm.
if a patient, it will start with certain symptoms which are very mild. Now, if that patient is getting treated in a very early stage and he is on proper medications, the obstruction is relieved. The overactive bladder will not even develop, because it was to develop
Yes.
if that obstruction would have persisted over a long period of time, and the patient might have
Mm-hmm.
ignored it over a period of time, and therefore overactive bladder sets in then in a later stage. Now, if it is treated in a
Mm-hmm.
timely manner at an early stage, overactive bladder will not happen. It will be prevented. But it might not be the case in primary overactive bladder, where the symptoms itself are leading to the diagnosis, and there was not a certain condition which we could do anything about so as to prevent it. Yes, we do
Yes.
prescribe, do advise patients or otherwise people to maintain good bladder habits. Good bladder habits
Mm-hmm.
meaning that don't prolong your urination for too long. Don't start and stop your urination for any reasons.
Indecent.
Drink adequate amount of water. Your urine color can guide you about the water intake you need to take. If your urine is clear, white, transparent, it's fine. If you are frequently passing dark yellow colored urine in the day, multiple times in the day, it means you are dehydrated. Now, dehydrated urine might irritate your bladder, so you need to avoid this by increasing your water intake. So these are the things that one can follow to maintain a good bladder health. Also, one should avoid constipation, which can be avoided by increasing your roughage in your diet. And if that's
Mm-hmm.
not working, certain laxatives to your daily routine, which might help, because constipation again affects the bladder functioning.
Okay. The person who takes alcohol can face the problem of overactive bladder more frequently. What will be your answer on this?
Alcohol per se doesn't cause overactive bladder. although it exacerbates its symptoms. Now, a certain person is having overactive bladder. He is a diagnosed case of overactive bladder. His bladder capacity is 100 ml. So if he drinks 200,
Mhm.
500 ml of water, so in the next 2 or 3 hours, he'll have to go to the toilet 5 times. He'll have to excrete those 500 ml urine. 100 ml पे signal मिल जाता है, again has to go. Now, if he drinks uh, 2 pegs of whiskey with that 500 ml of urine, 500 ml of water, he'll have to go 6 or 7 times. Why? Because alcohol acts as a diuretic.
Mhm.
Diuretic, it increases the amount of urine that one is forming. It increases the rate of urinary excretion from the kidney. So again, the number of urination, the time between two urination for such patients will be further exacerbated, and the symptoms will get worse.
Okay.
That is all due to the diuretic property of the alcohol. That is the urine forming property of the
Mhm.
alcohol, not exactly the alcohol itself is causing overactive bladder.
Okay. Can genetics cause this overactive bladder issue?
There are certain rare conditions where genetics are known to play a
Mm.
role, where overactive bladder is part of the whole syndromic condition. But there is no,
Mhm.
like, genetic predisposition might happen that if a certain generation has overactive bladder, the next generation might be more prone to developing it. But there is no clear genetic role in diagnosing such patients and treating them.
Okay. Dr. Rahul is here with us and he's asking how important is fluid management for overactive bladder?
Pardon, please, can you repeat that question?
The question is how important is fluid management for overactive bladder?
How important is what management? Fluid management.
Fluid,
Okay,
yeah,
fluid.
fluid management.
If you already touched upon that part, actually, that person spending most of his time indoor must limit his fluid intake to 2.5 liters. You don't need to have excessive fluids. सो बहुत बार हम लोग सुनते हैं कि
Mhm.
एक जनरल एडवाइस किसी ने दे दी कि भैया पानी पियो, बहुत अच्छा होगा, बहुत पानी पियो, जितना पानी उतना अच्छा। आई ट्रीट
Mhm.
पेशेंट्स हु आर कम टू मी सेइंग वी ड्रिंक 6 7 8 लीटर्स ऑफ वाटर अ डे। तो बॉडी का तो यूज है नहीं
Mhm.
वो 7 लीटर्स का, तो जितना एक्सेस है वो
Yes.
उसको यूरिन फॉर्म में निकाल देगी। ठीक है, तो अगर आपको अच्छी ब्लैडर हेल्थ मेंटेन करनी है, यू कैन टेक 2 लीटर्स, आप 2.5 लीटर्स, दैट्स इनफ। आप बहुत आउटडोर एक्टिविटी में हैं, स्वेटिंग ज़्यादा हो रही है, वाटर लॉस ज़्यादा हो रहा है, तो उस केस में यू कैन इंक्रीज इट टू 3.5 लीटर्स, बट दैट्स इट, नॉट मोर देन दैट। अनदर पार्ट ऑफ फ्लूइड मैनेजमेंट दैट्स वेरी इंपॉर्टेंट इज नाइट टाइम फ्लूइड्स। तो बहुत सारे लोगों की आदत हो जाती है कि सोने जाने से पहले एक गिलास दूध पीना है, कि सोने जाने से पहले भैया
Mhm.
रात में प्यास से नींद ना उठे, इसलिए 1 गिलास पानी, 2 गिलास पानी पी लेते हैं, 1 लीटर पानी पी लेते हैं। तो ये सब बहुत खराब
Yes,
चीज़ें
they
हैं।
do.
ये क्या है कि आपको बार-बार नींद आपकी डिस्टर्ब करेगी। नाउ गुड अनइंटरप्टेड स्लीप इज़ मच मोर इम्पोर्टेंट देन यूरिनेशन, देन गोइंग टू द यूरिन रिपीटेडली। तो अपनी
Mhm.
इंटरप्टेड स्लीप से आपका स्ट्रेस लेवल डाउन होता है, आपकी ओवरऑल हेल्थ इम्प्रूव होती है, तो दैट इज़ वेरी इम्पोर्टेंट। वैसे भी आफ्टर सर्टेन एज
Yes, it is.
स्लीपिंग हैबिट्स टेक अ टोल, तो स्लीपिंग हैबिट्स वैसे ही
Mhm.
आपकी डिस्टर्ब हो जाती है। तो इसलिए नाइट टाइम फ्लूइड्स व्हिच वी डिस्क्राइब कि 2 आवर्स बिफोर बेड टाइम यू शुड अवॉइड एनी अननेसेसरी फ्लूइड। डोंट ड्रिंक बाय हैबिट, ड्रिंक बाय थर्स्ट। आपको पानी
Mhm.
की प्यास लगी है, मीन्स योर बॉडी इज सिग्नलिंग दैट यू नीड वाटर, आप थोड़ा सा पानी जाके पी लो। डोंट ड्रिंक इट आउट ऑफ कंपल्शन, आउट ऑफ हैबिट कि हाँ मेरी आदत है, मैं तो 1 लीटर पानी पिए बिना सोता नहीं हूँ, तो दैट्स नॉट हेल्दी।
Mhm. Yes. Doctor, thank you so much for giving the time. Can you please sum up if any question is left या फिर आप कुछ add on करना चाहते हैं, you can say to our viewers.
Yeah, I don't. Yeah, mostly we have discussed everything. Just in the end, there are a couple of messages that I would like to send to our viewers and to a platform, that first of all, that it is a treatable condition, especially directing that information to old post-menopausal female patients, because I have multiple research papers over female patients suffering from such patients, and I've seen a lot of patients not presenting to doctors just thinking that this is how it is meant to be. So that's not the case. This is very treatable condition. You just need to have a visit a couple of times, do some basic investigations, take some medications, and you will be very well treated. No doubt about it. There are very small percentage of patients that might have persistent symptoms, but there are still conditions, there are still treatment lines, there are various lines of treatment that might help even very resistant patients. Another thing is that be aware
Hmm.
about this symptomatology, be aware about what overactive bladder is, and if you are having such symptoms, just don't panic. Just you need to visit your nearest urologist, and he might be the best person to help you out there. That's all.
Okay. Thank you so much, Dr. Vishrut Bharti, for your valuable time. It was quite an informative session for our viewers. We look forward for many more such sessions of awareness sessions in coming time. Thank you so much for being
Sure.
here.
It's a pleasure. Thank you.
And thank you so much, viewers, for an excellent participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you, everyone. Good day to all.
Thank you. Namaskar.